Did you know that in the United States alone, someone has a stroke every 40 seconds? That's over 800,000 people per year. But what if I told you there are warning signs that can appear weeks before a stroke happens? In this video, we're revealing 10 critical stroke symptoms you might miss. We'll also explore the two major types of stroke, their symptoms, why they occur, and most importantly, what to do if you or someone you know experiences one. Whether you're concerned about your health or the well-being of your loved ones, this video is a must-watch. Share this video to empower others with the knowledge to take control of their health. If you notice any of these symptoms we will be discussing, don't wait. Seek medical help immediately. Do not forget to like this video and subscribe to this channel. You will be surprised at what symptom number 9 is. This video reveals something equally important, which you can only learn by watching. So let's dive in. Did you know that having a stroke is just as serious as having a heart attack? Imagine waking up one morning and feeling a little off. Maybe your arm feels numb, or you're having trouble finding the right words. You shrug it off, thinking you just slept funny or are a bit tired. But what if it's something more serious? What if it's a silent stroke? Strokes are a significant health concern in the United States. They are the 5th leading cause of death, and the top cause of severe disability. What makes strokes so dangerous is that they directly damage the brain. Your brain is like a complex network of roads. A stroke is like a sudden roadblock that cuts off essential supplies to a part of this network. Brain cells need a constant flow of oxygen and nutrients. When that flow is disrupted, the brain cells die. This damage can have a wide range of effects on your body and mind. There are two main types of strokes, ischemic and hemorrhagic. The most frequent type of stroke is an ischemic stroke, which occurs when a blood clot or narrowing of a blood vessel, artery, limits blood supply to the brain. This prevents blood from flowing into additional brain areas and oxygen and nutrients from reaching brain cells. An ischemic stroke is like a traffic jam caused by a blockage in a blood vessel, often due to a blood clot. The second major type of stroke is hemorrhagic stroke. It can be identified by a burst blood vessel which allows blood to flow into or around the brain. This interruption limits the flow of oxygen and nutrients to brain cells while also exposing brain tissue to harmful chemicals that can cause cell death. A hemorrhagic stroke is more like a burst pipe, where a blood vessel in the brain ruptures and causes bleeding. The effects of a stroke can be long-lasting and vary depending on the area of the brain affected. Some people may experience physical disabilities like weakness or paralysis on one side of the body, problems with balance or difficulty speaking and swallowing. Others might face cognitive challenges such as memory problems and trouble concentrating. Strokes can also lead to emotional changes like depression and anxiety. While the risk of stroke increases as we age, it's important to remember that strokes can occur at any age. Factors like high blood pressure, sex, race, high cholesterol, smoking, diabetes, family history of stroke, obesity, and heart disease can significantly increase your risk. Knowing the signs of a stroke is like having a secret weapon in your health arsenal. It's about taking control and being proactive, not letting a stroke take you by surprise. The 10 signs of stroke are: Number 1. Sudden weakness or numbness. Do you know how sometimes your arm or leg falls asleep and feels all tingly? Imagine that happening suddenly, but maybe it's not just tingling, it's weak, heavy, or numb, and it is on one side of your body. That could be a sign of a stroke. I know that sounds scary, but knowing what to look for is important. So if you ever think someone might be having a stroke, remember the acronym FAST, F for face. Ask the person to smile. Is one side of the person's face drooping? A for arms. Ask the person to raise both arms. Does one arm drift downward? S for speech. Ask the person to repeat a simple sentence like the sky is blue. Is the person's speech slurred or strange? T for time. If you see any of these signs, don't wait. Call for medical help immediately. A stroke is like a plumbing problem in your brain. Like a house with a burst pipe, the longer you wait, the more damage it does. Even if the symptoms disappear quickly, getting them checked out is still super important. Every minute counts regarding a stroke, so don't hesitate to call for help. You could save a life. Number 2. Confusion or trouble speaking. This can manifest in different ways. You might struggle to find the right words, your speech might become slurred, or you might have difficulty understanding what others say. You might also feel confused or disoriented. This can be particularly frightening because it affects your ability to communicate and understand your surroundings. It happens because the areas of the brain responsible for language and communication are very sensitive to changes in blood flow. A stroke can disrupt these areas, leading to these symptoms. Don't dismiss this as a simple mistake or a senior moment. If you or someone you know suddenly has trouble speaking or understanding, call for medical help right away. Number 3. Sudden shortness of breath. We often take breathing for granted. Each inhale and exhale happens automatically, orchestrated by a vital area of your brain called the brainstem. Think of the brainstem as the master control center for essential functions like your heartbeat and, of course, your breathing. It monitors your body's oxygen needs, ensuring each breath delivers the right amount. But when a stroke occurs, this intricate process can be disrupted, potentially affecting the brainstem and throwing this delicate balance into chaos. Feelings of anxiety or panic can accompany this as your body struggles to cope with the sudden lack of oxygen. If you experience this symptom, seeking immediate medical attention is crucial. Number 4. Dizziness or loss of balance. Your brain is like a bustling control center with different departments managing various tasks. One of these departments, the cerebellum, is like your body's balance center. It ensures you can stand upright, walk straight, and coordinate your movements smoothly. See a stroke as a sudden interruption in the brain's normal operations, like a power outage in a specific department. If this power outage hits the cerebellum or the inner ear, which also helps with balance, it can lead to dizziness or a feeling of losing balance. It might feel like the room is spinning, almost as if you've stepped off a merry-go-round. Or it might feel like you feel unsteady on your feet, like you're walking on a boat in choppy water. You may also feel like you're about to fall over. There is a sense of instability and lack of control. Sometimes this dizziness can also make you feel nauseous or even vomit. The critical thing to remember is that sudden dizziness or loss of balance can be a warning sign of a stroke, especially if it comes on without any apparent reason. Don't ignore it or wait it out. Time is crucial when it comes to stroke treatment. If you or someone you know experiences these symptoms, call for medical help immediately. Number 5. Sudden severe headache. Your head is like a peaceful, quiet room. A normal headache might be like a fly buzzing around, annoying but not a big deal. But a thunderclap headache? That's like an explosion suddenly going off in the room. It hits you out of nowhere with absolutely no warning. 1 minute, you're fine. The next minute, you're in the worst pain imaginable. It's not just a bad headache, it's the kind of pain that makes you want to scream. You might feel sick to your stomach and want to throw up, and even the faintest light or sound feels like torture. This kind of extreme headache is a severe warning sign. It could mean that a blood vessel in your brain has burst, like a pipe exploding and flooding the room. This bleeding inside your head is what causes that sudden intense pain. A thunderclap headache is like a screaming siren telling you something is wrong. Don't ignore it or hope it will go away on its own. Call for help immediately. Think of it like this. If your house were on fire, you wouldn't wait around to see if the flames would die. You'd call the fire department immediately. Every second counts regarding a thunderclap headache, so get medical help as fast as possible. Number 6. Trouble walking or balancing. You may find it difficult to walk in a straight line, stumble or stagger, or feel unsteady on your feet. You may feel like your legs are heavy or weak, or have difficulty coordinating your movements. You will feel like the ground beneath you is moving, or your legs have a mind of their own. You might bump into things, trip over your own feet, or even fall down. Even simple movements like reaching for your keys or turning a doorknob become difficult and uncoordinated. This sudden clumsiness and loss of balance can be a sign that something is disrupting your brain's ability to control your movements. The signals from your brain to your body are getting scrambled. This is often related to dizziness and weakness caused by a stroke affecting the areas of the brain responsible for coordination and movement. Call your local emergency number for help. Number 7. Sudden nausea or vomiting. You might feel a sudden urge to throw up, with or without nausea. This can come on suddenly and without any obvious trigger like a stomach bug. This can be caused by increased pressure in the brain due to a stroke. The vomiting center in the brain can also be directly affected. If you experience sudden and unexplained nausea or vomiting, seek medical attention immediately, especially if other symptoms mentioned in this video accompany it. Number 8. Rapid heartbeat or palpitations. You may feel your heart racing, pounding, skipping, or fluttering. Feelings of anxiety or dizziness can accompany this. While this is not always directly related to stroke, a sudden change in heart rhythm can sometimes accompany a stroke. The autonomic nervous system, which regulates heart rate, can be affected. Seek medical attention if you experience a sudden change in your heartbeat, especially if other symptoms mentioned in this video accompany it. Number 9. Vision problems. It is like a sudden interruption in the flow of information from your eyes to your brain. This can manifest in several ways. One is blurred vision, which means the world around you might seem fuzzy or out of focus, as if you're looking through a misted window. This happens because the stroke has interfered with the brain's ability to process visual details. 2. Double vision. You might see two images of a single object, like a ghostly double. This happens when the stroke affects the coordination between your eyes, preventing them from working together seamlessly. 3. Partial or complete vision loss. A stroke can sometimes cause partial or complete vision loss in one or both eyes. It might feel like a curtain descending over your visual field, obscuring your sight. This is a severe complication that requires immediate medical attention. The reason behind these vision problems lies in the delicate structure of the brain. When blood flow to the visual cortex is disrupted, the visual cortex's ability to interpret signals from the eyes can be impaired, leading to the vision disturbances described above. Number 10. Changes in blood pressure. A sudden drop in blood pressure can cause dizziness, lightheadedness, or fainting, and a sudden increase in blood pressure can also cause headaches or other symptoms. This happens because of sudden fluctuations in blood pressure, which can be associated with stroke. The brain needs a consistent blood supply to function correctly. Your brain needs a steady flow of blood to function properly. It's like Goldilocks. Not too high, not too low, but just right. So if you notice sudden changes in your blood pressure, especially if you're also experiencing those other stroke symptoms we talked about, it's time to see a doctor. It's always better to be safe than sorry, right? Just like you'd call a plumber for a water pressure problem, you need to call a doctor for blood pressure problems. They're the experts and can help keep your brain plumbing in tip-top shape. You need to know something equally important. Stroke recovery is not always linear. Progress can be unpredictable, with periods of plateauing or even setbacks. Long-term recovery requires patience, persistence, and a strong support system. Silent strokes can still have long-term consequences, such as increased risk for future strokes or cognitive decline. Even mild strokes can have lasting impacts. While seemingly minor, even small strokes can disrupt daily life, affecting things like fine motor skills, memory, or social interaction. While seemingly minor, even small strokes can disrupt daily life, affecting things like fine motor skills, memory, or social interaction. We've discussed strokes, their signs, and how to spot them, among other things. Now let's discuss how to prevent them from happening. Here's your stroke prevention checklist. Number 1. Eat right. Your body needs good food. Load up on fruits, veggies, and whole grains, and try to limit junk food. Number 2. Exercise regularly. Get that heart pumping with regular exercise. Even a brisk walk around the block a few times a week can make a big difference. Number 3. Watch your weight. Carrying extra weight is like overloading your body. It puts additional strain on your heart and can lead to problems. Number 4. Do not smoke. If you don't smoke, don't start. If you do, quitting is the best thing you can do for your health. Number 5. Control your blood pressure and cholesterol. Your blood pressure and cholesterol are like the oil and coolant in your car. You need to keep them at the correct levels to run smoothly. Get them checked regularly, and follow your doctor's advice. Number 6. Manage your blood sugar. Controlling your blood sugar is super important if you have diabetes. Number 7. Go for regular checkups. Make sure you see your doctor for regular checkups. They can help you monitor and catch any potential problems early on. Preventing a stroke is a lot easier than recovering from one. So, take care of your body, and your body will take care of you. Remember, time is critical. The faster you get medical attention, the better the chances of recovery. Call your local emergency number immediately if you suspect a stroke. Don't ignore symptoms. Even if they seem minor or go away quickly, seek help. Knowing these signs could save your life or the life of someone you love. Take action now and share this important information with your loved ones. I hope this video has empowered you with the knowledge to recognize stroke symptoms and take action. Give us a like. If you have a personal experience or question about stroke symptoms, please share it in the comments below. If you want to learn more about health-related topics, subscribe and click on your notification bell to check out our next video where we'll explore another critical topic. Thank you for watching.